Hi, Dr. Peter Montgomery, family practice doctor, here to give you the coronavirus lockdown update, day 7. And we are still doing the 5 W's to stop the coronavirus. We all are washing, waving, wiping down surfaces, and whoa, don't touch this. Now I'm going to give you an update on what to do while you're locked down. If you're not feeling well, what are some advice you can tell? What am I feeling? Is it a cold? Is it a coronavirus? Is it the flu? I'll give you a little update on my thoughts on that and how to take care of yourself when you're sick and what you can do to prevent getting sick from all kinds of colds and flus. So watch this segment. Thank you. Sometimes you're not feeling well and you don't know what you have. I work with SSH Health in St. Louis, and our website has a graph here that may help explain some of the symptoms. For the COVID-19 coronavirus, very common that people have a fever. They feel tired and achy. Uh, General malaise is sometimes what it's called. You just kind of hurt all over. And it's usually a dry cough, usually not bringing up mucus early on. And they mention difficulty breathing and severe. All the articles I've been reading and from the handbook from the Chinese group that's been fighting it, the fever is usually low, 100, 101, whereas the flu, the fever is often 102, 103 is a story I hear often with that. And sudden onset, the COVID is described as a slow burn. The fever usually is just persistent at this low 100-degree level to 101-degree level for a week. Safe to say 5 days before things start getting worse in most cases. Few cases I've heard of people, running a fever in 2 days, but maybe they just weren't picking up the symptoms early on. But the best way to describe COVID is a slow burn, and influenza is a truck hit you. Everything happens very suddenly. In 25 years of people coughing on me and taking my flu shot, I've only gotten influenza once, and it was sudden. All of a sudden, I had the vomiting type, but diarrhea can happen. Sudden onset of high fever to 102, instantly could barely function. After the vomiting, I was coughing. The short of breath does happen. People do get pneumonias with influenza. The aches and pains, I thought I was sleeping on concrete. I have a 2-inch thick memory foam topper on my mattress. Yeah, I'm a wuss. But yeah, I thought I was on concrete. Everything hurt all over. My eyeballs hurt. It hurt to blink. In my office, people come in. I look for what I call pajama sign or fuzzy slipper sign. When someone comes in and they are crashed out on the examination table and they're there with a family member because they couldn't drive themselves, I go, oh, you have the flu, because they're seeking comfort and they're wearing the most comfortable clothes. COVID is a lot slower onset. Most of the stories, people are sick for a week with a low-grade fever and these symptoms. Then the shortness of breath hits. At that point, action needs to be taken. You need to be seeing your doctor. Rapid COVID test would be best. Currently, there is a delay for the time of testing to getting results. I personally am not waiting for test results to start a medication that has been around for 70 years that is very safe. I am out on a limb on this, but I think everybody will come around to this thinking very shortly. The Chinese documentation on their treatment says timely starting of antiviral medicine is essential. And I would say if you've had a fever for a week, talk to your doctor and consider getting on antiviral medicine quickly, especially in your high-risk group. People over 50 and definitely over 60 are dying at higher rates. And people with underlying medical conditions are at a higher risk. They do mention the aches and pains in a lot of the articles. It's, again, just a mild, slow burn kind of thing. The Chinese document said 50% of people had diarrhea. I would describe it as a severe diarrhea, but there's definitely some GI symptoms early on before the other ones get started. A common cold, Much more to have sneezing. Not a lot of sneezing with this. Not a lot of sneezing with the flu. A lot of cold and allergies are very commonly confused. As you can see, this common group of thing here: the sneezing, the runny nose, the stuffy nose, the watery eyes. I know when the trees around my house are blooming because I can't stop tearing up in my eye. The sore throat, the cold, you get the sore throat confused with strep. We can do a rapid strep test or a strep culture, see what's going on there. But again, these things, I have not heard any of these symptoms, these cold or allergy symptoms happening with coronavirus. I would agree with that, except for the aches and pains. Again, mild, slow, lingering symptoms for 5 days to a week. Seek medical advice. Now, when you are sick, and every year I have over 4,000 patients, active patients, and every year or so I will lose a patient to influenza. And this story is always the same. The family who goes, oh, he or she just lied there for a week. Oh, he was so achy and sore. He was too sick to come to the doctor. I don't ever want to hear that one again. Too sick to come to the doctor. Really? Because you can get him up and move him. He won't move? There's 911. If someone is too sick to go to the doctor, you call 911. This nurse saves lives. I know she's a villain in a movie, and her attitude on her face, she's a wonderful actress. Uh, Mean nurses save lives. Move your butt, get up, get going. You won't get going, I'm going to get help. That is what saves lives. The nice nurse goes, you just sit there, let me bring things to you. Patients have a bad habit when people are sick going into the patient role. Oh, I'll sit here and not bug people. I'll just sit here and ring the bell or ask for, something for comfort. Yes, we do recommend bed rest, but we don't need to stay in bed 24/7. You need to get up and moving. Mean nurse will get you going. People who take less pain pills and are practically forced to walk are the people who leave the hospital the quickest after surgeries or after any disease. You've got to get up and move. Obviously, the benefits of walking. The main thing here is we're talking about blood flow. Blood flow, all your immune system's in the blood flow. It needs to get moving there. You need to get it going around. You need to get the blood flowing out of the legs and the calves and up to the lungs and the heart and keep everything going here. Circulation is everything. You got to force the lungs to breathe deep. If you're just sitting around, you breathe shallow, water starts to build up in the little air pockets, and then eventually you develop pneumonia. So forcing yourself to breathe deep. A lot of people are in lockdown. A lot of people are in a situation where they can't get out. Do squats, do push-ups, do sit-ups. If you have a flight of stairs, up and down the flight of stairs a couple times, and then go back to bed rest and recover. But we got to keep your energy levels up. You're trapped in your house. You're in bed rest. You're self-quarantined because you know you're COVID positive and you don't want to spread it. You need to blow off some steam. You need to keep yourself well hydrated. Keep yourself going here. The fluids, you are breathing faster, you're running a fever, you are slowly simmering and sauteing on the stove here, and you need to keep adding water to this system. Water makes everything work in the body. It helps with the blood flow. It is the universal solvent. It makes everything work. Keep yourself hydrated. Keep yourself urinating. You're not urinating, you're not well. So get up off the couch in the bed every hour or two. Putter around, as I like to say, get some blood flow, get some breathe deeping, grab a glass of water, go to the bathroom, go back to bed. That's a healthy cycle. Now, obviously getting worse, short of breath, contact your doctor, call 911. If you're really having trouble breathing, you're probably going to be needing oxygen at that point. What can we do to prevent it? Lots of things to doing. I've been really pushing zinc. The reason the chloroquine and hydroxychloroquine work is because they help force zinc into your cells where they can gum up the works of the virus enzymes, and so they can't replicate, and also keep your infected cells from rupturing, releasing more virus, and triggering the cytokine release. Some very good research has been done on it. Zinc, it's not a question of if. Does it help? Of course it helps. It's clearly proven to help. The question is when, and that answer is as soon as possible. And again, family practice, we're all about prevention. I think everybody should be on a zinc tablet now. I've told my entire family, get yourself on a zinc tablet now. A multivitamin has some zinc. I've seen them have as little as 5 to 15 milligrams of zinc. Your average zinc tablet supplement will be 50 milligrams of zinc. Chelated or not chelated, I don't know the answer on that one. Get some zinc, let your body chelate it itself. You can do that. Get it inside you. What is it doing? It is doing many things, but basically people get better quicker and they're less likely to get sick in the first place. It has been proven to prevent. They did a study on those snotty-nosed kids at elementary school who are always getting things. They put them on a nice tiny 10 milligram zinc dose and followed them, and these kids got less sick. Very effective. All the other things that can be done to help. Clear evidence that vitamin D can help prevent disease and help you get better quicker. Why do colds and flus go away in the summer? Not magic, it's sunlight. The sunlight triggers our body to turn vitamin D2, which we've eaten, into vitamin D3, which does many good things to our system, helps prevent infection, and seems to encourage our immune system to fight better. You can get vitamin D3 as a supplement, and I've also strongly recommended all my patients and family members to start taking a vitamin D supplement. I had a family member get in a situation where he can get some seriously good sunlight for a couple of weeks. Him and his wife are in a good situation with some natural vitamin D. It is very, very hard to overdose on vitamin D. So although that is possible, I do not recommend any crazy doses. 1,000 units to 2,000 units a day should be sufficient for what we need. If you are sick, suddenly taking 50,000 units every day is not proven to be helpful and could over time cause problems. Vitamin C, yes, we know now a long time that it helps, and echinacea has some assistance, but I put most of my money on vitamin D and zinc. Vitamin C, let's eat some fruits and vegetables. Let's get it from nice natural sources. And echinacea is similar to ragweed. It's in the same family and might trigger allergy symptoms in some people, but it has been shown to be efficacious. So these are the recommendations. Here's the article you can read in detail for those who want to break it down. But the thing is, the science is in. This works. It prevents colds and viral infections and shortens the duration of them. I strongly recommend everybody to do that. So this is an update on the lockdown, day 7. It's been a week. This has been Dr. Peter Montgomery, MD. Thank you for listening, and I'm going to keep trying to do one of these every day to help everybody in lockdown so we don't go nuts. Let's stay sane. Let's stay positive. We can do things about this, and we need each other. Hang in there. Thanks.